Reported yesterday, as we come to a close with Breast Cancer Awareness Month, we want to sort through these studies, some of which conflict, and find out what they mean to all of us. So we've asked Dr. Dianne McCallister to join us. She is the Chief Medical Officer at Porter Adventist Hospital. She's here to help us. And this study that we talked about yesterday sort of brings up some conflicting information. It found that for every woman who was saved by a mammogram, 3 were treated. Did that surprise you? It surprised me as a layperson. Did it surprise you?
Not really, because the way we design screening treatments is to find everything that's wrong, and then you do further testing to determine whether it's wrong because it's cancer or if it's just an abnormality that's benign. So it's really, the way we screen is skewed toward finding everything.
So how do women end up getting treatment that they really may not need? How does that end up that way?
So if you think about it, if a woman gets an abnormal mammogram, the next step might be an ultrasound or a biopsy. And because when you get you don't know what the result of the biopsy is till it comes back. You don't know if you're biopsying a cancer or you're biopsying something else that's benign but just doesn't look right on the mammogram. So really, and it's designed that way to catch all breast cancer.
So there's some unnecessary procedures that are taking place. How do you think this new study is going to change the approach?
Well, actually, this study confirms the way we're doing things, because what it did is it showed a 20% decrease in the risk of dying from breast cancer in women who had mammograms. And the way that's done is that you test things to find out if they're cancer so you can treat them early. And some of the things you test will not be cancer. So it wasn't unnecessary when you look from the front end where you're doing the biopsy. It's just in 2020 hindsight, it was a normal thing.
Okay, get it. I get it now.
Because last year, when you came on and helped us through a study back then, I remember it changed when a woman should get these kinds of tests. So this is a little different than that. Right.
A panel last year suggested that women under the age of 50 not get screening mammograms. Now, the breast experts that I've spoken to, and in fact that whole division of oncology, really still recommend starting mammograms at age 40. You find less mammogram, or you find less cancer, so you're going to have more of those tests that are done on normal tissue. But the fact of the matter is, women under 50 years old have more aggressive cancers that you need to find earlier than women over 50. So it's always risk versus benefit. How much extra testing are you doing to find every cancer? And the general feeling is in the medical community that it's better to find the cancer and treat it and have a few extra biopsies done than to miss a breast cancer and have someone die from it.
Okay, I keep going back to these biopsies that turned out not to be necessary. What do you say to somebody out there who doesn't want to go through that? Biopsies can be painful.
Biopsies can be painful, and again, we need to be sure that we're giving women the information. So I would reframe it for you. It's not unnecessary. It's necessary to do the biopsy to determine whether it's cancer or not. Once the test is done and you know it's not cancer, you go, oh, well, maybe I could have gotten away without it. But it's one of those things you can't predict what it's going to turn out to be till you do the biopsy.
Clearly,
okay.
All
so
right.
Got to take that first step. All
right.
Dr. Dianne, thank you. Good information. Help us weed through all these different studies and tests. And you can find today's information on our website, thedenverchannel.com. Once you're at our homepage, you go down to the Lifestyle tab, and then you scroll over to Staying Healthy.
It's always so nice to have Dr. Dianne here
Clear it
to
up
help
for
us
us,
figure it out.